Hello, Forever family, and welcome to today's Product Power Hour. I'm Holly Stout, Vice President of Global Product Development here at Forever Living Products, and it's my privilege and my honor to get to work with a team of talented scientists, doctors, and chemists from around the world to formulate and work on the products that we eventually launch and bring to the forever world. I'm joined today by our esteemed scientist, Dr. Peter Pressman, who is a member of our Scientific Advisory Board, and today our topic is vitamins Uncapped. We're going to take a deep dive inside some of those daily necessities, and we're going to talk about the science, we're going to talk about format, and Dr. Pressman is going to bring that amazing scientific evidence as well as speak with that authority. He's been a scientist and a doctor for Dr. Pressman. I won't tell your age, but I know that you've been in the industry for a very, very long time, and he works with our talented scientists from around the world as well. So welcome, Dr. Pressman. It's always an honor to have you on our Product Power Hour.
Thank you so much, Holly. It's a pleasure to be here. A real privilege.
Dr. Pressman, if you recall, I sent you some of the Forever Living formulas or recipes, if you will, for some of our daily essential nutrients. That would include our Forever Daily, our Forever Nature Min, Forever Immune Gummy, Forever Calcium, and our Vitalize for Men and Vitalize for Women. And Dr. Pressman had the opportunity of looking at these recipes. He gets to see 1 to 100% of every nutrient and every ingredient in these formulas. And we designed a series of questions for him so that he can speak to the integrity and the science in these supplements, as well as dose and format. And we're even going to talk about when to take these supplements. So let's go ahead and dive right in, Peter. I am going to ask you the very first question. When we're looking at daily nutrition, does the format of the vitamin or mineral, meaning the form, does that really matter when it comes to absorption or function or results?
The answer is yes, no question about it. But let me pull back for just a second.
Great.
And so we're all on the same page on the basics. Let's talk about nutrition and vitamins, nutritional supplements as a subset of good nutrition and smart living. So nutrition in the broadest sense, I would say is one of the strongest and most agile, most adjustable factors that can be used to support and promote health, and to reduce the burden of disease during an individual's entire life. Nutrition is slow and steady. We're not talking about drugs here, which are fast and dramatic. We're talking about something that builds foundation, that builds resilience, and that builds a robust kind of resistance to illness of all kinds, both the communicable, the contagious, and the non-communicable. And I would say further that we need to make a distinction when we talk about vitamins. And let me preface this by saying this is a very dynamic area for research and development at this point. But we need to make a distinction between nutrient inadequacies and nutrient deficiencies. This is really a big deal. And I'll get to your question, I promise.
Oh, no, this is a perfect setup. I appreciate this, where you're talking about healthy nutrition. I love that you said smart living, healthy living, right? We're talking about complementing good diet, a balanced lifestyle. And I love that you're pulling back a little bit and really exploring what that means before we dive into what we're doing about it. So go ahead and proceed.
Absolutely. Absolutely. You framed that beautifully. And I think that when we talk about micronutrient or vitamin, mineral, electrolyte inadequacies, we're talking about the intake of nutrients in lesser quantity than the estimated average requirement. These are the kinds of problems we see in the United States. We see this in the developed world. We're not talking about situations in which we're looking at abject poverty or areas where there's great hostility. We're talking about right now inadequacies. These occur when the intake of a nutrient is above the deficiency level, but below the recommended dietary intake. So,
Mm,
unlike deficiencies, which lead to clinically evident symptoms, um, florid malnutrition, we're talking about hidden symptoms that affect the way our physiology adapts to the stresses and strains of modern life. I'll give you an example here. Uh, we talk about WHO, for example. The World Health Organization estimates that somewhere between 70 and 80 million children around the world suffer from the inadequacy of
mm,
vitamin A.
hmm,
Uh, in other words, in medicine, the lingo is subclinical deficiency. So,
mhm,
subclinical deficiency means that there are no apparent clinical symptoms, but what happens is that children who suffer that kind of inadequacy have higher infection susceptibility,
mm,
have reduced physical growth.
mm,
And so we're not talking about the in the realm of deficiency, that vitamin A deficiency might manifest itself as frank blindness. That's not what we're
mm.
talking about here. We're not talking
Right.
about the treatment of serious disease. Malnutrition, significant malnutrition is a serious disease state.
Mhm,
Um, and it's a complex disease state. We're talking about um, being able to live in the fast-paced world that we function in typically, where we're not eating regularly or properly, where we may be suffering from micronutrient deficiencies and our resistance to both infectious illness, viruses, um, and our resistance to things like metabolic syndrome, hyperglycemia, and even
mm.
frank diabetes. These things are real issues that we see with inadequacies. So
Sure.
nutrient inadequacies is what we're trying to compensate for here.
So, would it be fair then, Dr. Pressman, to maybe say that deficiencies are kind of into that category where you could go into drug necessity, and inadequacies are really where you had the supplement or the complement to that healthy lifestyle, where maybe you are eating generally well, but you still, just because of the food source or the way we're growing our food, you might not be able to get an adequate amount of those micronutrients we're talking about. So it'd be fair to say that the inadequacies are where supplementation comes into play. And when you go into those extreme deficiencies, that's where drugs come into play. Is that a fair statement?
Perfect. Absolutely
Great.
perfect. You're ready for your
Great.
residency.
Great. I love it. Well, then let's talk then. We have here at Forever Living Products, as you know, we're a health and wellness company, and we're founded on principles of integrity, high quality, scientifically supported formulations. And when we look at creating dietary supplements to meet a global population, that's a daunting task where we're providing a multivitamin designed for really any and everybody who may have what you mentioned, an inadequacy in some of those micronutrients. So when you look at some of the formulas at Forever Living Products, and we look at how we use scientific evidence to formulate, when we choose certain forms of vitamins or certain forms of minerals, does that matter? Does it make the body more readily available to use those? Does it really matter?
It does matter. We're talking about here how you complex the bioactive element,
Mm,
the particular vitamin with another compound such as a salt, or you phosphorylate it, or you do various things to optimize the bioavailability, as we call it, of that vitamin so that it is absorbed in the way it must be absorbed. rather than sloughed off as waste. Um, the other piece of this that I want to that I want to mention here before it sort of slides by the wayside is the rationale for what I really love about what Forever has designed in the supplements, the rationale for targeted supplements. And I'm thinking in particular of the Vitalize for women and the Vitalize for men. Um,
Mm-hmm.
Nutrition requirements change during the course of life.
Mm-hmm.
They change by gender. Gender requires certain supports for optimal functioning. The life course dictates particular requirements. During fetal development, infancy, and childhood, when growth is at a maximum, development is accelerated. Micronutrient intake is much higher with respect to body size than you see in older individuals.
Mm-hmm.
In adolescence, and healthy young adults, where you see a great deal of activity, exercise levels are usually very high. We see the loss of water soluble vitamins that need to be replaced. Um,
Mm-hmm.
we really need to think about the fastest growing segment of our population in older individuals, where the requirement of certain nutrients like vitamin D increases, while other
Mm-hmm.
nutrient requirements considerably decrease, particularly according to gender. Males do not require iron typically. In
Mm-hmm.
fact, iron supplementation can be quite dangerous
Mm-hmm.
and accumulate in tissues where it actually constitutes the precursor of pathology rather than help you. So your uh, supplements here, the targeted supplements reflect the varying needs across the life course. And that's
Right.
that's incredibly important.
So
Um,
let's talk about
yeah.
that more specifically, Dr. Pressman. Let's talk about women in general. And let's identify a couple of those key elements in general. Let's talk about standardized supplementation. Let's talk about women. What might be something that a woman could benefit from in a targeted supplement?
Well, one of the most important things, obviously, is the vulnerability to infection in the genitourinary tract. Urinary tract infections happen with great frequency. This is one of the most common one of the most common problems we see in primary care medicine. And I was particularly happy to see that Forever has placed a cranberry extract in the Vitalize for Women. Cranberry extract contains compounds called proanthocyanidins. The big name, um, which actually describes a set of compounds that actually reduce the likelihood that bacteria will attach to the inside surfaces of the plumbing. In
Hmm.
other words, when coliform bacteria, for example, E. coli, attach to the walls of the urethra, the uroepithelial cells, they do so with these very fine hairs called fimbriae. And it is the anthocyanidins that actually block a great deal of that process. So they reduce the likelihood that that bacteria will attach and infect the tissue. It,
Which would lead in a urinary tract infection, right?
which
That's what we're
would
talking.
which
We're
would
talking about E. coli, which could just be one of those harmful bacteria in, like you mentioned, a female's plumbing that would create a
absolutely
urinary tract infection. Yeah,
absolutely.
yeah.
This is a normal process where bacteria find their way into the urethra and ascend and attach. And when they form attachments, that sets the stage for infection. If you block that attachment, then the simple urinary flow will wash those bacteria out and reduce the
Hmm.
likelihood of infection. So we're not treating infection here. We're
No.
not saying this is a drug. This is a micronutrient which actually mitigates the likelihood of infection. So you're
Right.
supporting health, and that's incredibly important for women. Um,
Mhm. And that
another
comes from a cranberry extract, right? We
it,
know from a scientific standpoint that the cranberry extract is notorious for being able to provide a support to a female in a targeted supplement.
Absolutely,
Yeah.
absolutely. We have decades of clinical experience, and this is interesting because we're beginning to come full circle in recognizing that a lot of the botanicals and a lot of the naturally occurring substances that traditional medicine has used for literally hundreds and even thousands of years are now being essentially rediscovered by modern Western medicine. And what happens then is a lovely marriage of Western science and technology to optimize the way we extract and process these compounds, these botanicals, and these phytopharmacologic substances, and
I
and
like
and
that word.
then and then adjust them for optimal supplementation when our natural diet might simply not allow us to get enough. So
Right.
that brings me to another question, which is I think one which we discussed previously, which has to do with dose. The
Yes. Let's
dose, the
talk about
dose
dose.
response is absolutely critical, and this is another area where I've been impressed by the compounding and the design of the supplements that you guys have put forth here. Um, eh, Very often we see supplements that are wildly in excess of the recommended daily requirements, and those
Right.
recommended daily requirements are developed scientifically and
Right.
are based on many years of replicated studies in many populations at all stages in the life course. And we can take that as at least some kind of a gold standard. Now,
Mm.
if you exceed the recommended daily requirements, as we've said, you're into the drug realm or into the
Right.
toxic realm. Now,
Right.
what you guys have done, for example, in your dosing for the targeted male and female vitalized products, is say 2 tablets twice daily. So why do we do that? Why is that
Mm.
important? Well, it's very for two reasons. One, by taking sort of a pulse dose twice daily, you are effectively sustaining a therapeutic level in the blood. In other words, you're not taking a single huge dose,
Mm.
which may exceed a therapeutic level, or you may be taking a dose that oversaturates the transporter. Let's talk a little bit about saturable transporters. Another fancy term, but one which is incredibly important and crucial for the design of a proper supplement. There are transporter systems within the wall of the gut, within the mucosal lining of the intestine, which grab various micronutrients selectively and transport those nutrients into the bloodstream. Now, you if you provide a huge dose of a compound, you're going to supersaturate the capacity. You're going to overwhelm that
Mm.
transporter. So what's
Mm.
going to happen is it's not going to work efficiently. and only a small quantity of that substance is going to be absorbed.
So the body is smart, right? The body knows how much it can take, how much it can leverage, where to use those types of micronutrients. And when you overwhelm that transportation system, it's going to discard that. It's certainly very smart where it's going to say, okay, thank you. I can use this much, but you've given me way too much. So it's going to discard what it doesn't need and then transport those small elements to exactly where the body needs it.
Exactly. Again, you've framed it beautifully. The body is smart. It knows what it needs, and it will absorb just what it needs. So if you give it too much, it'll either muck up the system, it'll clutter it, it'll make it inefficient, or it will simply result in you sloughing off or eliminating that excess nutrient, either in stool or in urine. And that doesn't help anybody. So saturable transporters is very, very important concept here.
So, Dr. Pressman, if we're looking at a supplement, and you touched on this a little earlier, so we've really touched on three very, very important topics that I really want to dive into. And the first was the dose. So, if I'm looking at a supplement, should I look to see that it has 100% of every one of those micronutrients in the RDAs, or is it okay that there is something in a 20% or a 30% ratio? Tell me, am I looking for 100% straight across the board?
No, not at all. 100% is not necessarily what you need or want.
Right.
We're in an age now where we are beginning to move into something called precision medicine or personalized medicine. And what precision and personalized means in terms of how we support our health is that various people, let me put it this way, there are at various points in the life cycle and for various individuals that we can generalize about, you can very easily overwhelm what's necessary and again end up in a toxic kind of a situation. Vitamin D, for example, you have a lot of vitamin D in the male vitalize. Less vitamin D in the female vitalize. Why? Because in women, particularly in reproductive age women, you have vitamin D receptors in huge numbers, in great density in the ovaries and the endometrium, and so you don't need to provide excessive amounts there. Whereas with males, we have much lesser a lesser density of these receptors. So you've got to provide more in order to find the optimal saturation. So these are important in terms of nutrient absorption, and that's again very, very critical. The other thing that's critical is that we shouldn't talk about single vitamins as replacements here. What we want is a synergy between a number of micronutrients that work together, that work in concert. And so we call this an entourage effect or a synergistic effect. And when you combine balanced support, and Vitalize uses that term and makes good on it, because you're combining all these various elements, botanicals paired with vitamins, paired with minerals, in quantities that are complementary. When we talk about low doses, and you talked about 100%. Well, why is 100% maybe not so good? The answer is that we can easily overdose on vitamins. In fact, there are a whole set of diagnoses that are termed hypervitaminosis diagnoses. And what we want to do is avoid that at all costs. There's a truism in biological systems that we've known for some time and that people are rediscovering yet again in the research literature. and that is hormesis. Hormesis talks about what a dose response relationship that is conserved across virtually every living thing. And that means that usually small doses, and in this case of micronutrients, of vitamins, and of minerals, electrolytes, small doses produce a stimulatory effect, which is desirable. High
Mm-hmm.
doses produce typically an opposite effect, an inhibitory
Mm.
effect, which is
Mm.
typically quite negative and
Right,
undesirable. So
right.
what you want to do is not provide 100% or 180% or or even 1,000%. You don't want to do that because you're going to have the result be um, pathology. If you take
Mm-hmm.
too much vitamin C, and I'm very impressed that the amounts that are very low in Forever supplements, if you take too
Mm-hmm.
much vitamin C, that can be precipitated out and turn into a kidney stone, an
Oh,
ascorbate or an ascorbic
wow.
acid salt kidney stone. So
Interesting.
what we want to do is respect the power of micronutrients,
Mm.
taking advantage of the support, and that's critical.
That's, Dr. Pressman, that's one thing I really want to drive home with our consumers and anybody who may not be a part of the Forever family watching this podcast here. I really want them to understand that when we do these scientific formulations and we recommend 2 tablets, one in the morning and the night, or just 2 tablets twice, 2 times daily, that is a very strategic way to introduce these micronutrients into the body. We live in this society, I know especially in the United States, if a little is good, well then surely a lot is better. And then too much will overwhelm the body. And people feel that vitamins are just, that they're something that you can toy with. They feel that, oh, it's just a vitamin. It's just a vitamin C. It's going to pass in my urine. And they think, well, if more is good, then I'm going to front load the body with as many as I can. I'm going to take all my doses right at once. I want to advise that caution in that these doses are strategic based on those synergistic combinations, but also on the way we want the body to leverage those micronutrients. So too much is exactly what it says. It's too much. You don't need to front load or to double up on your dose. What we recommend has been studied by science.
Another great example. Again, let's go back to Vitalize for Women.
Mm-hmm.
You have a relatively low vitamin B6 dose in that
Mm-hmm.
vitamin compared to the many other supplements that are on the market. Well,
Mm-hmm.
why? Because there's a recognition that vitamin B6 is critical, it's water soluble.
Yeah.
It acts as a coenzyme for several enzymes that are essential for amino acid digestion and
Mm-hmm.
neurotransmitter synthesis and fatty acid metabolism. This is a critical cofactor. But too much B6 can risk neuropathies. We again look at another example. When you're fine tuning the dose for women, you got to think about the effect of what's the difference between men and women. Let's talk about estrogens.
Mm.
Estrogens, particularly if you're on hormone replacement therapy or oral contraceptives, estrogens have the effect of increasing or activating the liver's detoxification system. That effect is great up to a point, but it also accelerates the breakdown of vitamin B6, of folate, of vitamin C, of magnesium, and you that promotes the renal excretion of those vitamins. Those need to be replaced. And so you
Mm.
guys add that, and you add that in higher quantities than we see in the Vitalize for men, because testosterone has a very different effect. So we have to recognize the differences.
Mm-hmm.
One of my colleagues says we're all the same, but we're all different. Human beings, physiology
Yeah,
at some level is all the same, but we're all different according to gender, according to life course, according to our particular lifestyle. And that's where it's important to really tailor the vitamins as specifically as possible. But obviously, we can't make a separate product for every individual. So,
exactly.
designing these products, we're targeting groups, and
Yeah,
and we're targeting them first and foremost in terms of safety and then in terms of efficacy. So
right.
we got to be able to generalize about safety, which we can here because these doses are low and they're designed very specifically for the particular consumer,
Great.
male, female, young, older, that kind of thing.
Going kind of coming up a little bit now, so we've kind of we've dived into the targeted more for men and women. Let's just talk general population. I'm going to ask you a very general question. Does the general population, everyday individuals, do they really need being the operative word? Do they really need a multivitamin or a multimineral? Is that a need in today's world?
That's a great question. That's a really, really good question. Um, and I think we're beginning to see how to respond to that. Um, let's go back to inadequacies versus deficiencies. Um,
Mm-hmm.
we can in the Western world, in the modern world, we can probably survive quite well without supplements.
Mm-hmm.
But are we doing the best we can do? Probably not.
Mm-hmm.
And the reason I say this, the Great NHANES database, which is the largest database that is maintained in the world that covers nutritional intake and health status, um, has you interrogate that database, and what you see is that there is something like 70% of all Americans, of all healthy adult Americans, are not getting the the minimum daily requirements of micronutrients.
Mm-hmm.
So there, by definition, they are suffering from a micronutrient inadequacy. Now,
Mm-hmm.
maybe they're not acutely ill and they don't have to run to the emergency room for a specific problem, but they may not be functioning at their best. They may
Mm-hmm.
not have the immunologic responsiveness and integrity that you otherwise would have if you met those requirements, because we do know that many of these micronutrients support various levels of immunologic function and give us some resistance to the kinds of things that we encounter on a regular basis. Um, we even have considerable data that says that those who suffered particularly bad bouts of COVID were suffering from micronutrient inadequacy. Um, and this we saw people in the ICU. I took care of people in the ICU who were diabetic. What is the vulnerability there? The vulnerability is impaired immunology from not only excessive glycemic levels, excessive sugar levels, but these are folks who have impaired nutrient absorption.
Mm-hmm.
So um, so it's very, very important. I think we can bridge all this data to answer your question and say that probably most of us do require some sort of micronutrient supplementation
Yeah.
to make absolutely certain that we're getting what we need for optimal health.
That's a great point, Dr. Pressman. You know, I think oftentimes we live in a society where we call it a fast food society, right? Where we are really eating to feel full. We are not eating to nourish the body. And we oftentimes don't pay attention to our overall health until we get sick, right? We think, oh, I'm doing fine. You know, I'm getting a little bit of lettuce here and I'm eating my vegetables and I'm drinking my greens drink and whatever. And we think that we're doing enough. And we really don't pay attention. We don't bring out the big guns until we get ill. And you mentioned, you know, having to go into those critical states where you now need the assistance of somebody much higher up than yourself to help you feel better. And you also, that's where you go into those deficiencies and go into the drug world. Whereas taking care of yourself with those micronutrients and that general daily support, we're not talking about preventing illness at all. We're talking about supporting your body at its optimal level. I love that. It's not a bad and a good, it's a good, better, best. And the best practice would be that to continue to seek those nutrients from good, healthy food choices, to live a healthy lifestyle, smart living, as you mentioned, and recognize that once you get into the state of those critical where you're feeling unwell, at that point, you now have crossed the barrier of supplementation and now you're into where you now need substantial medical care. And that's not what we're addressing here at Forever. We really want you to live. I like what you said, that word optimal. We want to provide the body optimal support so that as you are living a typical lifestyle and you're reaching for those fast food moments, which is okay, we all do it, you have something that is giving you those foundational micronutrients, a daily vitamin. You know, we have our Forever Daily product that I take every day just because I know that it supports that feeling of well-being. It supports my overall intent to reach out and grab a healthy lifestyle. That is my personal effort. I don't want to wait until I'm unwell because then those efforts are drastic. They're a little less known. And I want to support my body as I'm living a healthy lifestyle along the way.
Look, if there's such a thing as preventive medicine, this is it.
Yeah.
I think medicine is the province of physicians who treat florid or frank illness.
Mm-hmm.
Preventive stuff is what we do on a daily basis.
Yeah. And it's an individual thing, right? It's an individual responsibility.
Absolutely. And it ought to be, because we're fine-tuning what we do within the context of our crazy lives and all the stresses and strains and everything else. If we're not eating well, actually. I mean, we're suffering from either too much of the wrong thing or too little of the right thing. You know, I didn't have time for breakfast, I didn't have time for lunch, and then I'm so exhausted at night, and all I want is a glass of wine and something light. And before you know it, you may not be critically ill. I mean, you're young and healthy, you can essentially get away with anything.
Yeah.
But what happens then is when you do, God forbid, have an accident, when you have something traumatic happen to you, whether it's an injury or whether it's an infection, how well are you going to be able to resist that? How quickly are you going to bounce back from that? Where's the resilience? The robustness, the lack of vulnerability is all about how we have prepared ourselves over a long period of time. So that comes down to decent nutrition and regular graded exercise. So, you know, and I say that in the same breath, because together with nutrition, you've got to do something on a regular basis, right?
Absolutely. Consistently. Consistency is key.
Consistency is key. Routine is key. And because we don't have that kind of consistency guaranteed, one of the things that we can do to support that level of vitality is to be smart about nutritional supplementation. And I think the one thing I would say is that the mass of the iceberg below below the surface of the ocean is what we do. I mean, that's the muscle. That's your power. That is the basis for your health. And that's what we're doing here. We're trying to polish health and prevention. I don't know about what a physician does to help in prevention except to counsel patients. But we unfortunately don't do that very much these days.
Yeah, it's
That's
unfortunate.
it's very unfortunate. And I can speak as a physician and tell you that I think in primary care we've abdicated our responsibilities to educate our patients, to educate consumers. And I think we have to change that. And one of the things that I really appreciate about what you're doing right now is that you are educating, you're raising a level of awareness. And this is not easy stuff, and I appreciate that. This is very complicated and very nuanced, but what it boils down to is how we can be instrumental in supporting our health, our well-being, our resistance to illness in our daily lives without having to see a physician. And
Right.
again, we are absolutely not saying that you can treat illness or injury this way because you can't. That doesn't work. That's
That's right.
that's for the physicians, for the surgeons, for the intensivists. Then, and God forbid you need that, we are there. We love to do that stuff. And
Right.
this hopefully will reduce some of our business. And
Sure.
that's what we want to do. Because
Yeah. Well, let's talk for a minute, Dr. Pressman, about the immune system, right? Where the immune system, I think oftentimes it's quite misunderstood at the general consumer level. They just think that the immune system is something that's fighting off whatever is going to attack the body. But when you talk about those inadequacies, let's talk about some key, because we do have a product called Forever Immune Gummy. Let's talk about some of those micronutrients, those vitamins and minerals that are known or clinically studied to help support the body's immune system, which is really that body's first line of defense as you're supplementing. Let's talk about what are some key vitamins, key minerals that the body can leverage to help support a healthy immune system.
you know what? Again, I'm gonna dodge this question a little bit. Because rather than single out individual vitamins that are important, like zinc, for example, or vitamin
Right.
D.
Right.
And we know that they participate in both in cell-mediated immunity and in antibody-mediated immunity. We know that, and
Right.
we could talk ad nauseum about that. But what you really want to do here is talk about the entourage. You want to talk about the team here. This is not like one hot dog. What you want is an entire team of balanced elements that complement each other and support the production of antibodies, that support immunoglobulin production, that support the health of our barriers, that support the health of our T cells, of our B cells, and this exquisitely complex system that we call, our immune system. So I think that again, it really is about a balanced and a balanced and nuanced, more precision approach.
Yeah. I agree. Dr. Pressman, does the body store vitamins and minerals long term? Like if I'm going to front load with a lot of vitamin C, a lot of vitamin D, is the body going to store, and I'm talking like long term, like 6 months, 12 months. Let's talk about that. Can the body store those vitamins and minerals?
Great question. The answer is an emphatic yes and no. So some things we store, some things we pee out. So
Right.
what you're really talking about here is the distinction between water-soluble and fat-soluble vitamins. Many vitamins and many drugs are fat-soluble. Vitamin A, vitamin E, very important fat-soluble vitamins. Vitamin B's, complex vitamin C, water-soluble vitamins. And that has a huge impact on how we dose these vitamins.
That's
and
right.
what the pluses and minuses are. If you for example have stored a great deal of vitamin A in your fat depot, as sometimes happens, what happens then when you go on a diet and lose a few pounds? Well,
Mm.
you break down that excess fatty tissue for
Uh-huh.
energy reserves, and in so doing, you're also liberating stored vitamins, stored micronutrients, stored
Mm.
drugs. And those drugs, when
Interesting.
liberated, enter the bloodstream, and it's as if you suddenly took all kinds of drugs or all
Oh,
kinds of
interesting.
vitamins. So you
Huh.
can, in effect, if you're a little overweight and you go on a diet, you may actually find that without even taking vitamins, you're getting an excessive dose of vitamin A, which can be liver toxic, or
Mm.
vitamin D, which can also be toxic, and promote bad things.
Mm-hmm.
So what we have to appreciate is that you can store certain vitamins, and that is a further that's further reason to be very respectful of how we use these things,
Mm-hmm.
and not to make the leap and say, oh well, eat like I eat very poorly, so I'm going to take not only this 100% recommended daily allowance, but I'm going to take two, or
Yeah.
I'm going to take the vitamin enriched meal replacement in conjunction with my vitamin supplement. Probably a very bad idea.
Ah, so I like that. So you're saying we should also be mindful of the collective intake of those key micronutrients. So if we're taking a supplement that has, a high amount of B vitamins and C vitamins, and then we're taking a meal replacement and then another dietary supplement that has that same concert of vitamins and minerals, we need to be aware of that. We need to understand that the collective intake, it's not, you can't look at each product in isolation. You have to recognize that if each product contains high amounts of those B vitamins, you're now overwhelming the body at that point. So
Yes,
you not only need to look at those doses, but you also need to be aware of a collective product range that you may be supporting your body with.
exactly.
Yeah.
Exactly right. And this again goes back to the dose response problem. And it adds another layer of complexity because we're talking about our body's dynamic qualities. And by dynamic, I mean we gain weight, we lose weight. We gain
Mm.
volume that dilutes things, and we lose volume that concentrates things. And that plays into all this too. And again, these 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 formulas are designed so that we undershoot, that allow us a margin for that variability and that error, and that's
Mm.
very, very important. So
Mm.
you want to use a supplement that is designed with all this in mind, rather than something that you may be able to get in bulk on the internet,
Mm.
for what looks like a steal.
Yeah.
Can be very, very dangerous. Very
I think
dangerous.
about that, Dr. Pressman. I see these huge amounts of vitamin C, in the EU, in our European Union. 60 milligrams of vitamin C is the maximum amount that you're able to use in a dietary supplement. And that makes so much sense to me. We live in the United States where you can go to one of these big, huge stores and buy bottles of 1,000 milligram vitamin C. And people are thinking, again, if one is good, then five are surely better. It's a
Right,
water soluble vitamin. It's
right.
going to pass right through me. And I think oftentimes we don't realize that when we flood the body, it's not at that point a vitamin. It can really transition into something where you think you're doing good, you now have crossed the barrier into the body's not able to use it. And not only is it not using it, it's transforming into something less optimal or less ideal than what you had originally intended because of your lack of understanding of these powerful micronutrients in the proper doses.
Beautifully said.
Yeah,
Yep,
thank you.
yep.
Dr. Pressman, I am going to put you on the spot a little bit, and I'm going to ask you, I know we're talking about formulas, and we do have these beautiful, well-balanced formulas in our Forever Daily and our Vitalize products and our Forever Nature Min and our Immune Gummy that has this beautiful concert of vitamins in the right doses designed to provide a healthy immune system that's healthy to continue to remain healthy, right? It provides that daily support. Are there 3 key vitamins or minerals that you believe that anybody and everybody could benefit from? And we don't have to necessarily even talk from supplement, like what we're getting from foods. You've identified one as iron, specifically for women. Can you talk about maybe 2 or 3 more key vitamins or minerals that really everybody should be aware of, that they're either supplementing or identifying in their food source?
Sure. The great inadequacies and deficiencies globally, and we're talking about 2 billion people who are suffering from a combination of deficiency and inadequacy. At least 2 billion people globally.
Wow.
Iron, number 1, as we've said, and critical for the formation of hemoglobin for our blood, so we're not anemic. Number 2, probably vitamin A. Number 3, iodine.
Iodine.
Iodine, very, very important. Iodine, you cannot make your thyroid hormone without iodine. So we must have iodine. And then I would say it's followed by zinc. And zinc is incredibly important immunologically. It's incredibly important early on in life in the formation of healthy heart valves. So this is important. So iron, vitamin A, iodine, zinc, folate is another big one. Folic acid in its salt form, folate, which is the bioavailable form, is incredibly important to prevent neural tube defects. So spina bifida, other neural tube defects. We have now, by law, we put folate in bread and other products. Many nations have that. So there's progress being made on that score. But these are the compounds that really are key in terms of global inadequacies.
Dr. Pressman, I can really appreciate that. You and I discussed something yesterday that I thought was kind of one of those aha moments for me, and that's going back to address iodine, where we do see this surgeon in people with these huge deficiencies, which are really contributing to these massive issues with some of those major hormones in the body. Why do you think, you mentioned one of the rationale or one of the thoughts behind where this iodine deficiency may be coming from, or what the trends are today that now has got this consumer movement that used to not be. Let's talk about that a little, because I thought that was really fascinating. Those little shifts in consumer behavior that make a massive difference in a long-term population.
So we're talking about hypothyroidism, actually. So an underactive thyroid gland. In fact, the by far the most commonly prescribed drug in the United States is Synthroid or thyroxine. It's the thyroid hormone. Thyroid hormone replacement, a big deal. People present with symptoms of fatigue, of weight gain, of just not feeling right. And lo and behold, we see that they're hypothyroid and require replacement. So the most commonly prescribed drug. If we go back and we look at the nutritional patterns, the dietary patterns for many of these folks, what do we see? We see that they're number 1, using less salt. We've heard for years and years and years that salt is terrible.
Yeah.
Well, not really borne out by the most recent and replicated evidence. But salt, why is that important? It's important because salt typically for many, many years in the same spirit as we required folate replacement in bread, for example, we have iodized salt. So iodine is supplemented in the salt that we typically get, whether it's Diamond
Right.
Crystal or Morton, you pick your brand.
Yeah.
And what has happened is that our salt consumption has decreased, for better or for worse.
Right.
And what we've done instead is have a love affair with all these gourmet products like Himalayan salt and pink salt and kosher salt and
Yeah.
and various salts which are not iodized, and
Yeah.
we're that has been supported by a little bit of overly enthusiastic consumerism that says, well, iodized salt is part of this processed food kind of thing. And we don't want to
Yeah.
do that. We don't want anything that's been added,
Right.
that's synthetic and added. Well, the result has been that the normal routine intake of iodine has decreased effectively because we're not getting iodine in the one condiment that actually provided the vast majority of our iodine.
That's so interesting. I like this.
As a population, we're beginning to become hypothyroid, probably at least in significant measure because our
Gosh.
iodine levels are not adequate.
That is just, so you called it a boutique salt, right? The consumers move into this direction and we think, oh, these new gourmet or boutique salts, they're better for you. They're from a pure source. They're not diluted, as you mentioned, or they're not added to. And yet what we don't realize is we're lacking those fundamental, again, micronutrients that the body needs. And in the pursuit of something that is a popular trend, we're moving away from the scientific evidence of what the body truly needs to defend itself and support it at an optimal level. It's very important.
Very important. And increasingly, we're seeing decisions made, public policy decisions, and public health decisions being made on the basis of emotion and perception rather than on the basis of evidence. And we need to also look at the quality of that evidence. And since I brought up the whole salt issue, that's a classic example. People demonstrated over and over and over again across many populations, both healthy populations and those who were suffering from, for example, from cardiopulmonary disease, cardiovascular disease, high blood pressure, that they were consuming salt. Well, sodium chloride, salt, it's very, very interesting. The research demonstrated that if you took people and you gave them a very low salt, very low sodium chloride intake, that sure enough, their blood pressure would fall at a statistically significant level. But what does that mean in terms of a clinical impact? Statistically significant doesn't necessarily mean clinically significant. In other words, blood pressure would fall 3-4 points, both in systolic and diastolic. Is 120 versus 124 significant clinically? Is a diastolic pressure of 74 versus 70 clinically significant? The answer is no. It probably is not at all clinically significant. For most people, with the exception of the tiny subset of people who are salt responders, who have a very hypersensitive salt response, the diminution of salt or the reduction of sodium chloride in the diet doesn't mean a thing.
Yeah.
Doesn't mean a thing.
That's fascinating.
Except likely that we're making ourselves iodine deficient.
I could summarize this perfectly, and this is thanks to you and Dr. Wally Hayes from our Scientific Advisory Board. Dose matters. The amount or the percentage of those micronutrients taken at the right times of day matters. People differ. There's a bell curve of people. How you use those micronutrients is contingent on your age, your gender, your lifestyle, your own health, your own health, whether you know what's going on inside your body or not, what you're contributing, those extrinsic factors that are contributing to it. And then science evolves. What we learn about science, it differs and it evolves, and you want to look and consult multiple disciplines. That's why I'm so appreciative for you and our other scientists that you are able to come with different disciplines of science and advise us on the safety, the efficacy, combinations, as you mentioned. I like, Dr. Pressman, that you keep coming back to it. Let's not look at just one vitamin. I'm always asked in my role, what is the benefit of this specifically? And I have to always respond the same way. I'll say, look, you can't look at just that one element. You have to look at the entire formula. It's not just focusing on one element, one benefit. You have to look at the smart formulation that fits into a healthy supplemental lifestyle. And going back to that final thing is that supplements are not drugs. They could be if you abuse them. They could be considered and react in your body in a negative way if you overconsume or you use them in a way that's not originally recommended. But they are designed really to support the body and to be leveraged in support or complement to a healthy lifestyle, getting right food sources, eating a balanced diet, staying mindful, staying in that meditative, that healthy mindset, getting that activity. And I'm not talking, running marathons. I have so much respect for those who are out there in extreme sports, but I'm saying get up and move your body more. If you're doing laundry, put a few extra steps in place. If you're going to the mailbox, walk around the block. Just don't walk to the mailbox. Get that additional mobility because your body is going to respond in the most glorious and powerful ways. Now, on the converse side, supplements are not designed to prevent you from getting sick. We're all going to experience illness at some point in our lives because there are just points that you're exposed to things the body simply cannot defend. And that's where you are so grateful for these medical, these resources that can help advise and support you. But overall, general nutrition is about you, and it's about you being smart and selecting those supplements that can give you an overall balanced approach to helping support your body. And Dr. Pressman, I'm so grateful and so proud in my role that I get to work with so many people like you that can advise us as we're creating these formulas. We've got some exciting new products on the horizon here at Forever Living Products, and they are these smart formulations with that quality testing, the advice of esteemed scientists like you in the right dose, designed to support that optimal feeling of well-being for the human body and for the human population around the world. So with that, Dr. Pressman, I am going to thank you so much for your time today. It's been so valuable. You just deliver such a wealth of information. I'm going to actually ask you to wrap this up, and I'm going to say, if you could say one last thing to our forever world, we have every country watching, we have all of our FBOs around the world and new customers that are maybe even considering coming on board and trying some of our products. What would you like to say to them in wrap of this session?
Oh boy, I think you can encourage with great confidence the routine use of this product line. These products are, I'm delighted to say, are absolutely the gold standard for the industry as far as we're concerned. We've looked at this stuff in terms of the biology, in terms of the toxicology, and in terms of the details of how they are designed, and they stand out as truly superb adjuncts to health maintenance, and I think that's what's important here. It's all about maintaining health. It's all about optimizing our vitality, our resistance, our resilience. And the caveat, the cautionary piece is that, as you have said so clearly, Holly, and it's beautiful the way you said it. This is not treating disease. We're not treating disease. We should never make recommendations in a general sense for anybody. If somebody is coming to you with specific medical questions,
Yes.
They have to be referred to a physician. And
Yes.
that's the gold standard right there.
Mm.
But in terms of health maintenance, I don't think you can do better on the nutritional supplement side than choosing one of these products.
Wonderful. And you've got those recipes right there in your hand. You see 1 to 100% of what's in them, and you have all the experience behind you. So thank you. Thank you so much for sharing your wisdom and your intellect with us, and for those final words. And to our Forever FBOs and those new consumers who are thinking about trying our Forever Living products, welcome. I hope this has been helpful for you. And as always, I'm wishing you the best of success as you share more health and wellness with people around the world. And I'm always sending you the biggest hugs and loves.